Hello students, welcome in Nice Nursing Academy YouTube channel. NCLEX question: a trauma patient arrives with pale, cold, clammy extremities and slow capillary refill. Which type of shock is most associated with this clinical presentation? So patient symptom: pale, cold, clammy extremities are present and patient got with trauma. So which clinical presentation is here for the shock, type of shock? So option A, septic shock, option B, neurologic shock, option C, hypovolemic shock, and option D, anaphylactic shock. So already we know that patients met with trauma. So trauma patients or injury patients usually have the hypovolemic shock. So the correct answer is hypovolemic shock. But by this presentation also we need to understand that patient is having the hypovolemic shock, right? So the rationale behind here, hypovolemia due to the hemorrhage, GI loss or burns leads to decreased perfusion. The body compensates by clamping down peripheral vessels or by increasing systemic vascular resistance. So due to vasoconstriction, high SVR, systemic vascular resistance, which results in the classic cold clammy skin presentation. NCLEX highlight: in hypovolemic shock, remember the hemodynamics: low preload, low cardiac output and high afterload. High afterload, it means systemic vascular resistance will be increased. So low preload plus low cardiac output plus high afterload suggests the hypovolemic shock. So here the patient is having hypovolemic shock, right? Next question: a patient with history of recent myocardial infarction, right? MI, patient is having MI, presents with hypotension, tachycardia and pulmonary congestion. Crickles are present. What is the primary pathophysiology driving this shock state, right? So patient symptoms are hypotension, tachycardia, pulmonary congestion after MI. So what primary pathophysiology which drives the shock state here in this case of myocardial infarction? A option, massive vasodilation. B option, mechanical obstruction of blood flow. C option, failure of the heart to pump effectively. And D option, loss of circulating blood volume. We know patient is having myocardial infarction, so myocardium got damaged, right? And damaged myocardium is unable to pump the blood effectively in the circulation, and because of that the patient will have the hypotension. So the correct answer is failure of the heart to pump effectively after the myocardial infarction. Rationale: cardiogenic shock, right? This also known as the cardiogenic shock is caused by pump failure, usually in case of myocardial infarction, arrhythmias, heart failure. The heart cannot pump forward, leading to low cardiac output and a backup of fluid into the lungs, pulmonary congestion or the pulmonary edema. So in this case pulmonary congestion is present, that indicates the cardiogenic shock is present. Patient heart is unable to pump the blood into the circulation. We need to know cardiogenic shock is the unique shock with high preload due to the fluid backup despite having low cardiac output, right? So in cardiogenic shock the preload will be high and the cardiac output will be low, and because of that patient will have the shock condition.